Good day, my name is Danielle Louise of Villaseñor. I'm from BSN 1B, and for this video, I will be performing or taking the patient's vital signs. This includes their body temperature, the pulse rate, as well as their respiratory rate. So first, let's talk about vital signs. What are vital signs? So vital signs reflects the essential bodily functions of an individual, such as their heartbeat, their respiratory rate, their blood pressure, as well as their body temperature. Healthcare providers monitor and measures the vital signs in order to check the level of physical functioning. Moreover, normal vital signs can change due to age, sex, weight, exercise capabilities, and overall health of an individual. So first, we're going to take the body temperature. As for the body temperature, for the assessment, first you're going to have to assess for clinical signs of fever, clinical signs of hypothermia, the site most appropriate for taking the temperature, and the factors that may affect or alter the core body temperature of the patient. You're also going to have to determine the policies and procedures by the facilities, and you're also going to determine the client's record for medication for the increase or decrease of the present temperature. As for the planning, you're going to have to assemble the equipment and supplies that you will need for this procedure, such as the following: the thermometer sheath or cover, water-soluble lubricant for rectal temperature taking, disposable gloves if necessary, towel for the axillary measurement, and lastly, tissue or wipes. For the implementation, prior to performing the procedure, introduce yourself and verify the client's identity using agency protocol.
Hi ma'am, good evening po. My name is Danielle of Villaseñor. I'm your student nurse from NAST. So first ma'am, may I know what your name is?
My name is Donna Pinson.
Okay po, Miss Donna. So Miss Donna, ang gagawin ko po ngayon is kukuhaan ako po kayo ng temperature nyo. So gagawin natin is lalagyan lang po natin yung thermometer dun sa may kilikili nyo, tapos wait for a few minutes and then pwede na po natin basahin yung resulta. So is that okay with you po?
It's fine with me.
Second, wash your hands and observe other appropriate infection control procedures. Third, provide for client privacy. Fourth, place the client in an appropriate position.
So, Miss Donna, do you feel comfortable in that position po?
Komportable naman ako.
Fifth, clean the thermometer.
Paano ko na po kayo ng temperature?
Okay.
Place the thermometer to appropriate root or site.
Tapos, tayo lang po natin, tapos tutunog yan. Okay na po ako. Makikita na po natin.
Wait for the appropriate amount of time. Do take note that the electronic and tympanic thermometer will indicate that the reading is complete through a light or tone. 6. Remove the thermometer and discard the cover or wipe with the tissue if necessary. 7. Read the temperature.
So, temperature niyo po is 36.5.
Normal lang ba yun?
Normal po yun, ma'am.
Okay, salamat.
Okay, so, yun lang po. Do you have any questions po, ma'am?
Wala naman.
Okay, so, do you feel comfortable po? Okay naman po kayo?
Okay lang ako.
So, yun lang po, ma'am. Thank you po.
Thank you din.
As for the evaluation and documentation, first you're going to have to document the temperature in the vital sign sheet record, as well as you're going to have to report any abnormal results to the primary health care provider. And lastly, you're going to have to document the procedure in the client's record. As for taking the pulse rate of the patient, first you're going to have to assess any clinical signs of cardiovascular alterations other than the pulse rate, rhythm, or volume. Second, you're going to have to assess the factors that may alter the pulse rate. Third, you're going to have to assess the site most appropriate for the assessment. And you're also going to have to determine the policies and procedures for the facility, as well as you're going to have to determine the client's record for a medication that may increase or decrease the cardiac activity during the assessment. As for the planning, you're going to have to assemble the equipment and supplies needed for this procedure, such as the following: a watch with a second hand or indicator, and if you're using a Doppler ultrasound stethoscope, you must obtain the transducer probe, the stethoscope headset, as well as the transmitter. First, for the implementation, prior to performing the procedure, introduce yourself and verify the client's identity using agency protocol.
Good evening po. My name is Louise, Villaseñor. I'm your student nurse from BSN. So first, may I know your name, please po?
My name is Donna Punsal.
Okay po, Miss Donna. So, Miss Donna, ngayon po ang gagawin ko po is kukuha na po kayo ng pulso. Gagawin po natin is check lang po natin yung pulso niyo dito sa may wrist niyo. This will help us check your pulse rate as well as your heart rate and your heart beating. So, is that okay with you?
Yes, okay lang.
Okay po.
Second, wash your hands and observe appropriate infection control procedures. Third, provide for client privacy. Fourth, place a client in an appropriate position. Select the pulse point. Assist the client to a comfortable resting position.
So, do you feel comfortable in that position po?
Yes, it's comfortable naman.
So, Miss Donna, can I sit on the chair po habang kinukuha po yung pulse rate?
Sure, go ahead.
Thank you po.
6. Palpate and count the pulse. Place 2 or 3 middle fingertips slightly and squarely over the pulse point. If taking the client's pulse for the first time, when obtaining the baseline data, or if the pulse is irregular, count for a full minute. When 3 fingers are used in palpating the pulse, the proximal or index finger obliterates, the distal or ring finger empties the vessels, and lastly, the middle finger palpates and fills the vessel walls. You may also use 2 fingers consisting of the middle finger and the index finger. However, do not use your thumb because it has its own pulse that you may feel. 7. You're going to assess the pulse, rhythm, and volume.
Inyong pulse rate po is 71 beats per minute.
Normal naman yun, diba?
Normal po yan, ma'am. Okay, so yun po, ma'am. Do you have any questions for me?
Wala naman.
Do you feel comfortable po kayo kayo?
Yes, I'm good.
So, yun na po. Thank you po.
Thank you.
Gel and the tissue. As for the evaluation and documentation, first you're going to have to document the pulse of the patient in the vital signs record sheet. Second, you're going to have to report any abnormal results to the primary healthcare provider. And lastly, you're going to have to document the pulse rate, rhythm, and volume and your actions in the client record. As for taking the respiratory rate of the patient, for the assessment, you're going to have to assess the following: the skin and mucous membrane color, the position assumed for breathing, signs for cerebral anorexia, the chest movement, the activity tolerance of the patient, chest pain, dyspnea, And lastly, medication affecting their respiratory. You're also going to have to determine the policies and procedures of the facility as well as the client's record for medication that may increase or decrease the rate of respiration. For the planning, you're going to have to assemble the equipment or supplies needed for this procedure. For this procedure, you will need a watch with a second hand or indicator.
For the implementation, prior to performing the procedure, introduce yourself and verify the client's identity using agency protocol.
Good evening po ma'am. My name is Danielle Louise Villaseñor. I'm a student nurse from NUSD. So first po, may I hear name please po?
My name is Donna Ponsal.
Okay po, Miss Donna. So, Miss Donna, ang gagawin ko po sa inyo, kuhanan ko po kayo ng vital signs. So, I will check your pulse rate as well as your respiratory rate. This is to help check your heart rate as well as your heart rhythm and your paghinga po. So, is that okay with you po?
Yes, that's okay.
Okay po, ma'am.
Wash hands and observe other appropriate infection control procedures. And then provide client privacy. Place the client in the appropriate position.
So, do you feel comfortable in that position po?
Okay lang ako.
Okay po. So, Miss Donna, can you sit on the chair beside you po to check your vital signs? Is that okay with you?
Sige lang, go ahead.
Thank you po, ma'am.
Fifth, you're going to observe and palpate and count the respiratory rate. If you anticipate the client's awareness of the respiratory assessment, place a hand against the client's chest to feel the chest movements with breathing, or place the client's arm across the chest and observe the chest movements while supposedly taking the radial pulse. 6. You're going to count the respiratory rate for 60 seconds. An inhalation and an exhalation count as one respiration. You also have to observe the depth, rhythm, and character of respiration. You may observe the depth by watching the movements of the chest. Check for regular or irregular rhythm. And you also have to observe the character of respiration, the sound they produce, and the effort they require.
Okay, so okay na po, Miss Donna. So, ang inyo pong pulse rate is 71 beats per minute and yung respiratory rate po is 13 breaths per minute. So, normal po parehas ang inyong vital signs.
Okay.
Okay po, ma'am. So, do you have any questions for me po?
Wala naman na.
Do you feel comfortable po in that position? Okay
Yes,
po
I'm
kayo?
good.
Okay po, ma'am. So, yun lang po. Thank you po.
Thank you din.
For the evaluation and documentation, you have to document in the vital signs record sheet the respiratory rate of the patient. You also have to report any abnormalities to the primary healthcare provider. You also have to document the patient's respiratory rate, depth, and sound in the client record sheet.
That will be all for my video. Thank you for watching.